Welcome to Helping the Student with Diabetes Succeed. 2 levels of curriculum are recommended to help keep students with diabetes safe in school. This Level 1 module is for all non-medical school personnel. Objectives for this module are overview of diabetes, low and high blood sugar, and diabetes emergency, low blood sugar, and how to recognize and who to contact for help. This training is an orientation to caring for a student with diabetes. To advance each slide, just click the arrow button below. Check with your school nurse if you're interested in being enrolled in more diabetes training. Can you tell which one of these students has diabetes? The purpose of Level 1 module is to help you recognize the signs and symptoms of a student with diabetes may have when they are experiencing a high or low blood sugar. Recognizing these symptoms is the most important thing you can do to help students with diabetes succeed in the school setting. Diabetes management curriculum educates school staff about what diabetes is, how to respond to diabetes emergencies, and who to contact for help. Diabetes is a chronic disease in which the body either does not make insulin or cannot use the insulin it makes. Insulin is a hormone needed to convert sugar, starches, and other food into energy. Insulin is produced by the pancreas and works by driving the sugar in our blood into cells for energy. When the pancreas stops making insulin or our body does not use insulin properly, high levels of sugar build up in the blood. The sugar cannot get into the cells. The body loses its main source of fuel. When insulin is no longer made, it must be delivered to the body through insulin shots or through an insulin pump. When the body does not use insulin properly, pills or insulin shots may be taken. Neither insulin nor pills are cures for diabetes. They only help control the disease. Taking care of diabetes is important. If not treated, it can lead to serious health problems. The good news is that research shows that serious health problems can be greatly reduced or delayed by keeping blood sugar levels near normal. The goal of good diabetes management is to control blood sugar levels. The key to good blood sugar control is to carefully balance food, activity, and insulin or medication. As a general rule, food makes blood sugar go up and exercise makes blood sugar go down. Many other factors such as growth, puberty, stress, illness, or injury can affect blood sugar levels. With many factors coming into play, maintaining good blood sugar control is a constant balancing act 24 hours a day, 7 days a week. 2 conditions school personnel have to watch for in a student with diabetes are low and high blood sugar levels. High blood sugar is harmful to the body over time. Low blood sugar can become a medical emergency. Students with high blood sugar will feel thirsty, drink more, and may require frequent trips to the bathroom, and students may report increased fatigue. Contact your school nurse if you see any of these behaviors. Low blood sugar levels can be life-threatening and present the greatest immediate danger to people with diabetes. Very low blood sugar is rare at school and generally can be managed with prompt treatment when early signs of low blood sugar are present and recognized. When low blood sugar is severe, the school nurse or school staff must respond immediately. If symptoms of low blood sugar are suspected, get help immediately. Seek out your school nurse. Symptoms of low blood sugar are different for each student and may vary from episode to episode. Think of how you feel when you've skipped breakfast or lunch. This is how students with low blood sugar feel. A low blood sugar can happen very fast. A student with a mild episode of low blood sugar may show the following symptoms: shakiness, sweating, hunger or stomach ache, irritable, dizziness, sleepy or drowsy, not able to concentrate, and a headache. As the person's blood sugar continues to drop, the symptoms become more noticeable and can include a change in personality, lack of coordination, confusion, and weakness. As soon as symptoms of low blood sugar appear, treat on the spot. Give the student a quick-acting sugar product such as 4 ounces or half a cup of fruit juice, 8 ounces or 1 cup sport drink, a half a can of regular soda, not diet, 3 to 4 glucose tabs, or 1 tube glucose gel. These items may be found in the student's backpack, school health office, or school cafeteria. Call for help. Call the school nurse. The student should not be left alone or sent anywhere alone when experiencing a low blood sugar. If the blood sugar is not treated, it will continue to drop. If not treated promptly, a low blood sugar reaction can advance to a more severe state within minutes. A student with low blood sugar may have difficulty swallowing, have a seizure, or become unconscious. This is a medical emergency. Act now. Remain calm. If a student with diabetes loses consciousness or has a seizure, act immediately by laying the student on her side on the floor and calling for help. Call 911. Call your school nurse and let her know you have a student with diabetes who is unconscious or having seizures and your location. Do not attempt to give the student anything by mouth, and do not leave the student alone. Provide the student privacy by removing other students from the area. All students, even students who are independent in their diabetes care, will need help with a severe low blood sugar. Now that you know what a student with diabetes needs, check blood sugars. The student with diabetes may need to frequently check their blood sugar, especially if they're feeling symptoms of a low or high blood sugar or before exercising. Meals and/or snacks on time. The parent and/or healthcare provider will determine the appropriate diet and snacks for students. If there's a question about a student's diet, contact the school nurse. Fruit juice or other quick-acting sugar product for low blood sugar. If not able to swallow, call 911 as the low blood sugar is life-threatening and must be treated immediately. Thirst is a sign of high blood sugar. Students with diabetes will need additional water and bathroom breaks. And students with diabetes should participate in activities just like any other student. You may want to get a pencil and write down these resources and websites for additional information on diabetes. Click one more time for some more resources.